Matthew Bursey is a registered psychotherapist with over 15 years' experience in child youth mental health and 6 years in progressive leadership roles. Matthew is a clinical manager at ROC, Reach Out Center for Kids, and leads the live-in treatment and community outreach programs. Matthew has worked collaboratively to build partners and programs with the Children's Aid Society, school boards, and other community partners enabled to support children and their families. Matthew, thank you so much for joining me today. First of all, for those that don't know anything about ROC or the Reach Out Center for Kids, can you tell us a little bit about your services and what you do there?
Yeah, absolutely. So thanks for having me. One of the main things that ROC does is, as the lead agency for mental health in the Halton region, we serve children, youth, and families, specifically in the age groups of birth to 17. I'm pretty biased, but I think it's a pretty amazing organization that's been offering services for about 40 years now in the Halton region. I've not been a part of all 40 years, but it's definitely offered quality services around those times. And our services go around therapy, outreach, community-based prevention, residential, birth to six, autism, and group offerings, and especially our crisis services. So with all these services, the main focus is optimizing children and families' mental health and trying to improve the relationships within the families, bringing a better understanding to social emotional stressors and behavioral concerns that any family might be experiencing, especially during these times.
So that's the big question, and obviously we're on Zoom, we're not together, and things have really shifted during the pandemic. And that big word pivot comes up quite often. I would imagine originally a lot of your services were face to face or in house. So how has that shift to the virtual world affected, or maybe even enhanced, the tools that you're able to use?
Yeah, no, definitely. So I think it was about this time last year where we went into that lockdown. And so being an essential service, it really made us have to react pretty quickly. So we had our crisis service, which operates on telephone as they had always, but we had never been virtual. So having to move virtually was something that it wasn't natural, but it was so necessary, being an essential service. So some of the nuance and important pieces of counseling and therapy and psychology of just being in front of someone and reading their cues and making sure you're there to be with them through those stressful times is a very important part of the work. So it was really important for us to create that video conferencing like we are doing today, and have that support for those families. And for the region and even broader, we moved really quickly into video conferencing for families. And that was within a few weeks that we were up and running in that space. And I think that just shows like ROC is an organization that really wants to adapt and meet the needs of the community. And it's not just like the counseling and the therapy, it's our early on programs, which works with the birth to six kiddos and new families that are looking for that support, like that community when you're a new parent. And as the pandemic has pushed a lot of people into those isolated kind of experiences, it was really important that those programs get up and going. Another thing that we've done to adapt with the needs of the community was we built a lot more group offerings, and we had never run groups outside of in person in the past. So we had to move those online and figure out a way for those families to still feel connected and supported in those moments. And one of the groups that we've launched has had tremendous success, which would be our advanced caregiving group, which supports families on working through some of those difficult emotions with their children. And so that's running monthly and simultaneously 3 different times. So that's been a group that we've seen tremendous success and feedback.
One of the things that, was the first conversation when we talked about virtual school, because we all went through that at the beginning of the pandemic. Everybody was online. And it was, for lack of a better word, quite a hairy experience for some of us. And I'm sure you felt that as well through your clients. My kiddos have stayed home and are doing virtual schooling. And then we also have kiddos in school. And the conversation often about these children is is the mental health and, the resiliency of children, but also how are we helping them and being proactive? I would imagine that there has been an extreme increase in the services required. So how has that pandemic and the virtual aspect, how has all of that shifted the increase in needs for the Rock?
Yeah, no, good question. I can only speak to Rock's experience of that. And one of the things that I can speak to is that we have seen at the beginning, especially there wasn't that much of a volume increase because people were more just trying to figure out what a lockdown meant for them. Um, but as like the stressors of having to parent your children while at school and work from home, all those things, or job loss, or all the other big things that have happened during this lockdown, we saw that coming through the door. And so, like I had mentioned earlier, like the groups, right? With the increased demand, we realized that we had to figure out different group offerings around supporting your children's emotional needs, and also creating the live answer program. So that's like a great single point of access where someone can just call the phone and figure out what services are available to help you figure out what service is going to help me and my family, instead of having to go through, I'm going to say phone book, but I think that dates myself, but going through the Google search and figuring out which is the best way to looking through what would be the best way for working with your children and your family. So that single point of access, and then that person on that line can help kind of say like, okay, well, how about today you meet with a therapist and setting you up into our walk-in clinic, which has been the fabric of Rock for a long period of time. Our walk-in clinic has been a very strong part of our organization and leader in the province for mental health services. So families, if they're feeling that stress and need that support, I think a lot about fear and anxiety, right? Everything's so unpredictable in this chaotic kind of environment. And so our own kind of fear and anxiety and how we get support on that, we try to support the whole family. So if you're going and you're calling that line and you get connected to that walk-in clinic, those therapists, a mental health therapist, birth to sick therapist, can really help navigate those waters for you, your children, and your family.
What I want to make sure that I fully understand, and I would imagine the audience as well, is that Rock is open to anyone. So it's barrier free. You can call at any time and anyone can get services. This isn't a referral type program. Am I correct in that assumption?
Yeah, definitely. I think that's a very valid point. It's something that it's no fee for service. You can call at any time and get those services for free. And there's no referral required from your family doctor or hospital. That is something that, like I said, that live answer program is a program that would get you connected to a service right away for free. The other part is, if you're not able to call the live answer program, you can call or you can go on our website at www.rockonline.ca, and we have Quinn, which is our chat bot, which would be able to it will give you information and help navigate the system for you, give you information about services, give you information about the walk-in clinic, the hours of operation, and how you could get your children and family there.
The partnerships are a big piece of how we've seen other organizations pivot as we've been talking to them. We spoke with Tina Blanchford from CAS, and she mentioned Rock Services as well, and sort of the combined efforts there. Partnerships and the community working together is something that just our community in Halton does so well at. Tell me a little bit about your partnerships and who else you're working with to make sure that these little kiddos are taken care of and are able to thrive.
Yeah, for sure. And CAS is such a great partner for us, and making sure that we're meeting those needs for those families. That's a very important relationship for us, and making sure that we coordinate. And as Rock is a lead agency for mental health services in Halton, it's our responsibility to make sure that we're all working together and that we're making it easy and accessible for families to get that fluid access to service. So working with our partners is a very important mandate for us. And that goes through, we have Woodview Mental Health Services, Nelson Youth Center, community youth programs. So all these community programs we work really well with, but we also work really strongly with the police
Mhm.
and the hospitals in our region as well. So we try our best to kind of coordinate and collaborate to make sure that we are offering the most seamless and efficient service that we can for families. But that collaboration is really what makes Rock such a strong player in the mental health fields. So we have in our North Halton walk-in clinics, for example, there's another service called Adapt that
Mhm.
with addictions, and they will come and support youth and families in that program as well, and they have space to work out of our clinic there. So that's an example of some of the great work and collaborations that we do to this time.
There's certainly that holistic and community approach, which is necessary at times, certainly to make sure that the kids and the families are getting the top-notch services again, so they can continue to thrive. As we move through the pandemic and hopefully into a bit of a new normal, what is the vision for Rock moving forward? What do you hope to see for Rock and the kids and families that are with you now and that will continue to come through the doors?
Yeah, it's a great question, right? Because I think at first we're thinking, oh, it's just going to go right back to normal, and
Mm,
within that time, we all kind of anticipated that this wouldn't be the changed landscape, but maybe we have to keep looking forward in this way. And I think that's Rock's vision, is that it's a hybrid of service now. We're going to be virtual and offering services, because I think with that point, the like you asked earlier, like, do we have we seen strengths in this
mhm.
transition to the virtual? And we've noticed that there's families that had never accessed mental health services before,
Yeah,
people that weren't comfortable sitting in front of someone live in a therapy room. It wasn't maybe for them or for their children. So being on a phone or having that virtual support has been something that I think is going to be a big foundation part of Rock moving forward. I think also that's going to be the biggest takeaway going forward into this. And I
yeah,
think it's how do we kind of coordinate those services. And I think those things that came out of this, like live answer and
yeah,
those single point intakes, on coordinating between the different partners and making sure that if it's not appropriate for Rock, how do we get it to CAS or
right.
to one of the other partners that could really help support this family. Um, and I think that's a really important part. And I think, like, moving forward, in the message going from this is just making sure that families know where to reach out to.
Yeah. Well, thank you, Matthew, for your time today, and thank you to everybody at Rock for the services that you do provide for the littlest ones in our community. We're greatly appreciated, and thank you for your time today.
Thank you.
As a community, we are seeing supports for our youngest members' needs continue to increase. It truly takes a village, and Halton has many partners working together, sharing, collaborating, and supporting each other to ensure that we can meet the needs of our children now and for years to come.